lateral, and I have the patients over for me. Go ahead and roll into your left side. Roll completely onto your left side, please. Okay, just relax your legs. And slide your hips forward a little bit. Okay. Just bring your hands up and make it like a pillow. There you go. And I just want you want to make sure that the hips and the shoulders in the same line, or her hips and shoulders in the same line. No. Okay, I'm just pull your shoulders back toward me a little bit, just like this. Okay, so now her hips and shoulders in the same line. Okay, now we're doing the laterals because a lot of scatter is produced. We do want a lead blocker along the back of the thoracic spine. Okay. Now again, you got to make sure that the back is straight. All right. Okay, all right. Look at the wall over there. Okay, now look at the patient. Is the patient straight? Is her back straight? No, she's leaning forward. That's straight. I rolled her just a little bit forward. Okay. Go forward. Is the patient straight?
Yes.
Is the patient straight?
Well,
It's hard to tell. I can tell it's not, but until you develop that eye, put your cassette there and have them roll flat back against the cassette, then move the cassette and see how it looks.
oh, now we're back.
Okay? Okay, look away. All right. All right, is the patient straight?
No.
Which way?
I like it.
No, she's rotated backwards. See? The bottom's not touching. So, I get to the point, I just put my hand here.
Say the scapulas, you could definitely
Yeah,
feel.
just like you do in the lateral scapula or the lateral chest. I just put my hand here and then just rotate the patient back. And my hand's the straight edge instead of putting the cassette there.
Side stationary. And
Right.
shift.
So that get the patient lateral. I put the lead blocker there. The reason I didn't use the half aprons, a lot of times I'll say, we don't have those in clinic. Okay? And put the patient's right there. Can slide away from me just a little bit.
Okay.
Hips too, please.
All right.
All right, still in the same plane. Now I got room to work. Rotate her back so she's in lateral position. So now, I'm going to sacrifice, if I need to, the upper spine. Because I can't see them anyway. They're superimposed. Because the arms will be out in front. Okay, because you can't see the upper ones anyway. All right, so why am I going to risk maybe clipping T12 by doing something like this? Because I can't see these first one or two, maybe three anyway. So on my lateral, I would cheat a little bit and go here. And by doing so, I got room for my marker either here, or I mark my thoracic spines here. Because the spine curves like this.
Oh, where's your white field end up? How do you see it?
So,
Light field is to here, markers here.
since the spine curves, what do you use until we develop an eye? What do we use to make sure that she's lined up? I'm looking at her shoulder blade.
From-
Touch my scapula.
No, to make sure she's lined up, you want to go imaginary plane between the acromion and the top of the hip.
Acromion and top
Yeah,
of
it's
the
right
hip.
here. See?
Okay. Acromion. So don't look at all this.
Don't look
because
at,
that'll slow
especially
me.
if she's
Kyphotic,
kyphotic.
yeah.
Now, this brings up the point you have to kind of imagine. Okay, you have to kind of imagine, because sometimes on some patients you're going to have cone filled like this,
So I would
full
have-
film coverage.
I would have it like that. Is that
Then
too
you'd
much?
be- Yes.
I can over-rotate.
Okay. So again, just bring the shield up to the. If they got a lot of curve, you may need to use two shields. All right, and it does make a difference. Okay. So either get a second glove, thyroid shield, or something, and just kind of form fit it. All right, because that does make a difference. I might bring the cone in side to side a little bit, because her spine's pretty straight. So you just kind of have to imagine the curve of the spine. Okay, kind of bend yourself forward at the waist. and give yourself a kyphotic curve. Okay, because you get some people like that. So if that's the case, you know, you have to maybe bring her shoulders back and slide her hips forward,
And open it up.
and then open up to get. So maybe a full 14 by 17 cone fill. And if you get a very kyphotic, because some of these poor little, most of the time they're ladies. Every now and then you get some men, but the vast majority of the kyphotic patients are little old ladies. All right, so if you get some little old lady that's really hunchback there, you know, you just do what you got to do, which means you may have to have the spine centered where the head is here and the feet are here. So you want the center mass of the spine, the thoracic spine, in the center of your cone fill, as straight as you can get it. Okay, just relax. All right, now stay on your side. Now from here, what I tell her to do is go ahead and just bring your left arm up under your head, all the way, and reach out like you're trying to touch the wall in front. Just lay your head on there, and this arm just rests it down on your body like you're trying to touch your knees. Okay? Now in her case, I would not angle, because she has good separation. Because here's one shoulder, here's the other shoulder, so I got this much space to shoot between her shoulders. And I just, wherever the shoulder meets the neck, that's where I center. Okay? Now, most of your text, and again, I'd use a 10 by 12 cassette. Inches, 12, 10 by 12 cassette. On all my thrusts, on all my swimmer's views, I throw a little angle in there, 3 to 5, because this gives me a little more center right there. Okay, I'm centering my cassette.
What does the book say for the cassette size for swimmers?
10 by 12.
10 by 12?
Okay, or leaves it on her. Yep, there it is. Sorry. That's fine.
Oh, you do.
Huh?
So tiny.
Well, yeah. To make sure I have my Sheena's in the room, to make sure, and pinched it. So.
I love those.
All right, so there's centered a little bit right with this. Okay, and if you want to get a little cute, you got plenty of room for your marker up there, because here's the spine, and there's your swimmers. Now, what kind of breathing technique would you use for swimmers?
Like this,
Okay, book says expiration.
it says full expiration.
But-
instead of expiration.
Personally, I use orthostat. I use breathing technique, same as I do for the lateral
Trying to
lateral
move
T-spine.
The book says suspended respiration?
Expiration.
It's
Expiration?
expiration.
Throw it all the way out and hold it out?
Right. And then and either way, just before I go to make the exposure, I tell the patient to really stretch your arms down and get that good, and get breathing and tell them to hold. Or then tell them to breathe, relax, and then roll back on their back. Okay? Now, the swimmer's view is routine for the thoracic spine. You have the AP, lateral, and swimmer's view for the thoracic spine series. It's an optional view for the cervical spine series. When would you use it for the cervical spine series?
If you don't,
When you cannot see the inferior margin of C7. A lot of places, they can't see the top part of T1, they still want it. All right? Because this could be the bottom of C7, and you got a joining space here, but what if T1 was like this? That's why they still want to see the top part of T1. All right? So in the book, we'll go with the book answer, inferior margin of the vertebral body of C7. But in real life, they want to see all of that. Okay? All right. Now, I will show you the